We have Dr. Flora Gao as our guest, who will be discussing her experiences as a medical affairs resident at Astellas Pharma Canada. And she'll be going into about how to apply for an industrial pharmacy residency if you're interested in a similar position. Flora recently graduated from the University of Waterloo's School of Pharmacy Doctor of Pharmacy program. She is a licensed pharmacist and is currently finishing up her residency at Astellas. Welcome, Flora.
Thank you so much for inviting me, and I'm very excited to share my experiences about what life as a resident at a pharmaceutical company entails. I would just like to add a disclaimer that everything I say today is based on my personal opinion only and is for discussion purposes only.
Great. So let's get into our first discussion point. To give our audience a little bit of background on this topic, Flora, can you give us a brief explanation of what it means to complete a residency within a pharmaceutical company?
Sure. The Industrial Pharmacy Residency Program is conducted through the University of Toronto and involves a one-year paid residency position at one of the pharmaceutical companies in the program within a specific area. So, for example, I chose to specialize within medical affairs, but there are also other positions in regulatory, market access, and other functions. Residency is designed as an opportunity for new pharmacy graduates to enter and learn what goes on behind the scenes within industry while providing value to the companies they're working for.
Great. And what would your typical daily tasks or projects consist of?
So I'm a medical affairs resident, and every day looks a little bit different for me. Some of my more frequent or recurring responsibilities include reviewing scientific content, conducting research, creating tools, helping out with medical information functions, supporting the execution of medical affairs activities, and collaborating with team members in other departments. In addition, all residents are required to complete a residency project along with a report that reflects a business need. And a few examples of types of projects in the past have included creating a tool that organizes clinical trial information, literature reviews, or surveys among healthcare professionals.
Excellent. What benefits would this typically provide you with, and what kind of jobs would this eventually lead to?
So residency has definitely provided me with benefits in the form of valuable skills and experiences that I will continue to use later on in my career. Some skills that I've practiced over the past year have included critical appraisal, project management, communication, both in terms of delivering information and working with others, and medical writing. I've also learned so much new knowledge about industry itself, such as regulations within industry, what needs to happen before a new drug enters the market, what happens during different phases of the product lifecycle, and what different cross-functional teams within drug companies do. In terms of post-residency, there are different career paths, such as staying in pharma itself, whether that's in departments like medical affairs, regulatory, market access, or marketing, working for vendors that provide services for pharma companies, other organizations, or even returning to a traditional clinical position, just with the extra bit of variety in terms of past experience. With any pharmacy-related position, I think it's important to, for example, know where to go for drug information, know how to disseminate a clinical trial publication, and know how to effectively communicate scientific information to various audiences. So to summarize, residency has personally provided me with the opportunity to enhance certain skills as well as experiences that I hope to reflect on in the future.
Great. Those are all excellent benefits to residency. How and when would people typically apply for this?
Applications are open on U of T's website every fall around September, and I believe they're open right now actually for anyone interested in applying. The application involves an online submission and, if selected, interviews with the companies themselves. And if you want more details about residency and who can apply, there's more information on U of T's website.
Great. So if you're interested in applying for an industry residency, applications are open right now. What are some tips you can provide for those who are interested in applying for a residency position in industry?
So I actually get this question a lot. First of all, I always advise applicants to conduct research and learn about industry so that they can be more confident in their interests and demonstrate that they're aware of what type of work the roles they're applying for includes. Ways they can do this include reading about industry online, visiting company websites, attending events, and best of all, connecting with past residents. Another major piece of advice I often give is to connect past experiences with transferable skills that add value to the position they're interested in. For example, if applicants have experience in a non-traditional role, a research project, or other experience, they can discuss how they, for example, conducted research, converted data or information into some kind of deliverable format, or communicated scientific expertise to others. These are all past experiences that would be useful in industry, in my opinion. Now, I also don't want to forget to mention that people typically associate non-traditional roles with industry. But let's not forget about how traditional roles and direct patient care emphasize what pharmacy students and pharmacists do as healthcare professionals. Residents can contribute knowledge about how direct patient care occurs in a clinical setting and strategies for communicating with healthcare professionals and patients. Some people I talk to are surprised to hear that a lot of people who work for drug companies are actually not clinicians themselves, so depending on the company and scenario, residents may be providing a unique point of view. Last but not least, all pharmacy graduates can relate to learning new therapeutic information in a short amount of time, so that's a useful skill if and when they need to focus on a specific therapeutic area in the future. Overall, regardless of what type of experience people have, there are always ways to express how they bring value to the role that they're applying for.
Those are all very valuable tips, Flora. Thank you. Unfortunately, it's all the time we have. Thank you, Flora, for teaching us all about the world of pharmacy residencies in industry. It was a pleasure speaking with you.
Thank you. You too. Thanks again for inviting me.
Thanks.